My name is Alysha Preston. Today I'm going to be recording for SPD 100 Online. Today I will be talking to you guys about Parkinson's disease, and I would like to explain how the disease affects daily lives of those diagnosed. At the end of the speech, I would like for you all to gain a better understanding of the disease as well as any available treatment. Michael J. Fox is one of the most well-known celebrity faces attached to Parkinson's disease. He has established his organization, the Michael J. Fox Foundation for Parkinson's Research, as a means for people to learn more about the disease and help to find a cure for it. First, I would like to begin by explaining the beginnings of the disease. It was first described in 1817 by James Parkinson, who called the disease the shaking palsy in a scholarly journal. At times, the disease is also referred to as paralysis adjuvant. Parkinson's is a brain disorder that can occur in persons genetically and/or environmental. It occurs when the substantia nigra, which are brain cells, die or become impaired. These brain cells produce a chemical known as dopamine. This chemical allows for smooth, coordinated functions of the body's muscles and movement. 80% of this chemical must be missing before a person will see any Parkinsonian-like symptoms occur in them. Parkinson's is a chronic disorder, which means it occurs over long periods of time. Also, it is a progressive disorder, which means symptoms will worsen as time passes. Some environmental toxins that occur in the disease are 1-menthol, 4-phenol, 1, 2, 3, and 6 tetrahydropyridine, or NPT. According to the National Institute of Neurological Disorders and Stroke, researchers believe that at least 500,000 people in the United States currently have PD, although some estimates are much higher. Next, we will look at some symptoms associated with PD. Most symptoms that many people associate with PD are tremor, which could be shaking in hands, arms, legs, and jaws, bradykinesia, or slowness of movement, postural instability, and rigidity, which could be stiffness of limbs. Other symptoms, but not limited to Parkinson's, are depression, difficulty sleeping, small cramped handwriting, and muffled speech. Next, I would like to explain to you the diagnosis associated with Parkinson's and talk about who is eligible to get the disease. The disease is not easily detected, therefore patients should always seek a highly specialized doctor in the neurological field. If this option is not available to patients, they can always speak with a family physician, but should require that they review their medical history very carefully, as the misdiagnosis rate is highly significant in this disease. Patients should also always receive second opinions compared to those of their first doctors. At times, the disease mimics the following diseases: progressive supranuclear palsy, or PSP, and it can also mimic normal pressure hydrocephalus, or NPH. It is not a discriminating disease, as many other diseases are not. It affects all races, classes, sexes, and ethnicities. It normally occurs in people over age 65, but 15% of all cases were diagnosed under the age of 50. Usually, statistics show that 50% of more men than women are diagnosed with PD. Early onset of the disease can be inherited, but usually linked to specific gene mutations. Michael J. Fox was diagnosed in 1991 at the rare age of 30, which would classify him as the young onset. People with close relatives of the disease are at a higher risk of developing the disease. Only if that family has a specific gene mutation, then the family should possibly learn more about that family's medical history. According to the National Parkinson Research Foundation, in the United States, it is estimated that 60,000 new cases are diagnosed each year, joining the 1.5 million Americans who currently have Parkinson's disease. Also, according to the Michael Stern Parkinson's Research Foundation, one person every 200 people will be diagnosed with Parkinson's in their lifetime. Lastly, I would like to talk to you all about treatment options and ways family members of PD patients can be helpful to their family. There is no cure for Parkinson's, although there is a great amount of medication available. Some medicine that PD patients are currently taking are levodopa and cinnamon. Surgery, even though it is not the most safe, it is still the most effective treatment available to patients. Some types of surgery are deep brain stimulation, in which a doctor will place electrodes into the brain and connect them to a small electrical device. This reduces the chance for levodopa and other drugs to be available to patients. Other types of surgery are pallidotomy and thalamotomy. Family members of patients with PD, although it could be an extremely heartbreaking event to deal with in your family, you should always exercise great patience, be supportive and loving, seek help from other caregivers and or support groups in your community, and you should always try to join online communities to learn more about the disease and ways that you can help. Lastly, I would like to thank you all for joining me. I hope that you have gained a better understanding of the disease and how it affects the daily lives of those persons diagnosed with PD. This information is provided to inform you all of Parkinson's disease and as a means for people to seek further information on the disease. It is important for people to realize that although Parkinson's is an awful disease to cope with, it still does not defeat many. Thank you.